And welcome to Deuk Spine Institute. It is August 22nd, 2024. Our first two cases we did not broadcast. This is our first broadcast for the day. The first patient did not want broadcasting. We respect his rights. The second patient, we did a piriformis release in room 2. We don't have camera equipment, so if you want to donate, you're welcome to. And now here we are with a patient who travels here from Ohio, one of the important states for determining the election results this year. We're going to give you some numbing medicine. He's sleeping, but he's a thin man. He is not heavy at all. He has a very thin body, muscular, and he has pain down his right leg. His primary complaint is leg pain from a pinched nerve in his back. Now, he also has back pain, but it's not as significant for him as his leg pain. Shot? So we're going to go in and fix 2 discs with the Deuk laser disc repair. I think we're a little bit too high there on our entry point. Shot? All right, Jordan, I need to see that. You're off on the WAG for sure. I want to do 4-5 first. We're going to be fixing L3-4, L4-5. I'm going to put some numbing medicine. Shot? Now, the numbing medicine we're giving is not numbing the spine, it's numbing the soft tissues. Shot? Specifically, it's numbing the fascia, the fat, the little nerves that are running around in the soft tissues of the back. Okay? So, our first step in this procedure is to get into the disc, and specifically, we're going into what's called the annular tear. Now, Jordan, I cannot see down below. I need to see further down. You need to move your fluoro down. Okay, why? Because I always have to see the sacrum and L5-S1. All right? That is a little better, but you're too far south, and you need a WAG. I like that, Jordan. I'm happy with that view. Thank you. So we're going to access the L4-5 disc. Everyone agree, right? L4-5 is one of the levels we're treating. Shot? Our patient is literally snoozing. I can hear him snoozing. He is happily sleeping. Now, these patients for the lumbar Deuk laser disc repair surgery that we're doing today do not get anesthesia, general anesthesia. They get sedation, twilight. Shot? All right, we're navigating past the facets, and we are literally heading into the foramen. Shot, this is where the herniation is, right here, where the tip of that needle is. Let's get a quick AP. If you have questions, feel free to ask me. I'll do my best to answer them. Keep them related to spine or healthcare. Let's not get off topic. I know it's an election year. I don't like to share my political views. It's unnecessary. You could see some scoliosis. But certainly if you have questions about the spine surgery, physical therapy, chiropractic, lateral, any of that stuff, we'll talk about it, okay? What you're watching here is the future of spine surgery. And it is a surgery done to eliminate disc pain, discogenic pain, and unpinched nerves called nerve roots that are being pinched in the neural foramen. So we are going to be doing both. Fixing a tear in the back of this disc, which is causing his back pain, but also we're going to be unpinching the nerves that are being pinched from herniation. So I'm going to make an incision. This incision is 7 millimeters long. The whole surgery will be done through a tiny, tiny incision. This is the smallest surgical incision for spine surgery you can make. There's nothing smaller. Anything less than this is not spine surgery. It's just a pain management procedure. But this is true spine surgery. Shot? It's just the least invasive spine surgery that can be done. Shot? Now, we don't consider doing surgery through a needle to be surgery. We call that a procedure. And specifically, if you're doing surgery through a needle, you're really just doing a pain management procedure. Shot? It's not really surgery. AP? But once you make an incision that's more than, say, 2 millimeters, then it's real surgery. And the smallest incision we use is 4 millimeters. That's for the neck and for other things. But for the, we're ready for him. For the lower back, 7 millimeters, really is as small as it gets. So this is the least invasive surgery.
You okay?
But also, it's a surgery that actually works,
You all right?
unlike many spine surgeries that don't. How long has he had back pain for?
Okay, well, he says 3 months that he noticed the pain, but he doesn't, he said he had twinks years ago, but he doesn't.
All right, so on and off, he's got lower back pain and right leg on and off for 20 years. That's what it sounds like, but really bad for the last 3 months. So a big increase in 3 months. Okay. Now, turns out most back pain comes from a damaged disc called annular tear, and he has those. We're going to fix those today. Henry?
Yes, sir.
Why don't you show our audience all the different causes of chronic back pain while we do our discogram?
Copy that.
I'm Dr. R. Deuk with the Deuk Spine Institute, and we're going to discuss 30 causes of chronic back pain. Chronic back pain is back pain that lasts longer than 6 weeks, and there are 30 causes of chronic back pain. The most common cause is going to be a disc injury. Disc injuries such as disc herniations, disc bulges, disc ruptures, degenerative disc disease account for 86% of chronic debilitating back pain, and they are totally fixable with the proper treatment. The best treatment for disc injuries is Deuk laser disc repair. Let's take a look at the 5 lumbar discs that can be injured. The most common disc to be injured is L4-5, followed by L5-S1, then L3-4. The L1-2 and L2-3 discs are far less commonly affected. Next, we have facet joints. Facet joints are small joints located behind the discs in the back of the spine. There are 10 facet joints, each paired left and right, L1-2, L2-3, L3-4, L4-5, and L5-S1. The most common facet joints to cause chronic back pain are L4-5, followed by L5-S1, followed by L3-4, in that order. After the facet joints, which account for approximately 10% of chronic back pain, we move on to the sacroiliac joint. The sacroiliac joint accounts with the piriformis muscle for approximately 4% of chronic back pain. The sacroiliac joint is a joint located between the tailbone or sacrum and the iliac bone. There is a left and right sacroiliac joint. In this diagram, you can see the joints turning red, indicating inflammation and pain either in the left or right sacroiliac joint. These sacroiliac joint injuries and pain can be treated most effectively with the Deuk plasma rhizotomy of the SI joints offered at Deuk Spine or Deuk Joint Institute. The fourth most common cause of chronic back pain is a piriformis muscle injury. The piriformis muscle is located in the buttock, and there is a left and a right piriformis muscle. The muscle gets torn, unfortunately, when people bend the wrong way. This usually occurs in patients with orthopedic problems such as hip pain, knee pain, or back pain. By bending improperly, they put the muscle under too much stress and they tear the muscle. The torn piriformis muscle causes severe debilitating pain in the top of the buttock. There is a left and a right piriformis muscle, and this can be treated most effectively with the Deuk piriformis muscle release. This is performed percutaneously with a 4mm incision. The sciatic nerve does run through the piriformis muscle, and many patients with piriformis muscle syndrome also have sciatic pain down their legs, with pain, numbness, tingling, and weakness in the leg that's affected on the side of the piriformis muscle. Piriformis muscle can be treated with injections such as steroids, Botox, PRP, or stem cells. However, those injections always wear off and the patients end up coming back with the piriformis muscle pain that reoccurs. The most definitive treatment for permanent relief of piriformis syndrome is a piriformis muscle release. Next, injuries to the bones of the spine, touches the vertebral bodies. With trauma, can cause fractures of the vertebral body. Vertebral body fracture is diagnosed with X-rays or CAT scan or MRI, and they're treated with injection of cement into the vertebral body. Looking at the vertebral bodies, the most common to be affected is L1, followed by L2, then L3, L4, and L5. The sacrum can also be fractured. Finally, the coccyx is the last cause of chronic back pain. You can see in the diagram the red coccyx at the bottom. This comes usually from an injury where the patient falls on their bottom, sustains pain at the tailbone, and this can be treated with injections of the coccyx ligament. These are the 30 most common causes of chronic debilitating back pain, the most common being the disc, causing 85% of chronic back pain, followed by the facet joint, causing 10% of the chronic back pain, followed by the piriformis muscle and sacroiliac joint, which cause 4% of chronic back pain, totaling 99% of chronic back pain, which is totally fixable and curable with the right treatment. Thank you. I'm Dr. Deuk Majan. Thanks for joining us. All right, welcome back. So you can see from our video, we just showed you that there are about 30 things that cause chronic means it lasts longer than 6 weeks, back pain. And, you know, if you skateboarding outside and you fall off the skateboard and your back hurts for a day or two, that's not chronic back pain. That's just acute back pain. And it's very different diagnosis than chronic back pain. Chronic back pain is pain that you've had on and off or constantly for more than 6 weeks. And chronic back pain has very specific causes. They're different than acute back pain, which is post-traumatic back pain. Okay? The most common cause of chronic back pain is a disc causing pain in the back of the disc where there's a little tear in the posterior annulus, and that tear has to become inflamed to cause pain. You can't just have an annular tear, you have to have an inflamed annular tear. And to get an inflamed annular tear, you have to have inflammation. Well, what causes inflammation? What triggers inflammation? Inflammation is your body basically attacking the tear. And why would your body attack your own disc? Because it's abnormal. It's damaged. That's why your body is attacking it with inflammation. Okay? And that's what's happening in people with chronic back pain that comes from a disc injury. These are all pieces of herniation. Every single one of them is tiny. They're not any big ones yet. All I'm getting are tiny pieces. So, I know we have a question, and before we get to the question, I just want to show our audience another video. This one, on the other hand, is going to be about, there's the tear, by the way. You guys see that? Oh, it's beautiful, Henry, look.
Yes, we do.
Okay, guys, gals, not only are we seeing the tear, which is right there where the laser fiber is, but on the left of the tear, you see the pink color? That's inflammation. It's exactly what I've been talking about. And what you're going to see in this next video that explains why discs cause pain through inflammation in the tear. And that was first described by Dr. Deuk Majan, myself, here at Deuk Spine Institute. We've been talking about it for 18 years. So since 2006? Go ahead.
Copy that.
Disc injuries start with an annular tear, damaged nucleus. Pulposis herniates into the annular tear. The herniation triggers an inflammatory response within the annular tear. The inflamed annular tear generates pain signals.
And wonderful. We've just seen how a disc injury causes back pain, and it's through inflammation that's happening inside the tear in the back of the disc. We call that a posterior annular tear. That was discovered by myself, Dr. Deuk Majan, and my son, Arias Deuk Majan. This was 18 years ago we discovered that. We've been trying to share it with the rest of the world, but unfortunately, Most doctors just don't want to hear it. Oh, there it is right there, Henry. Look at that. I mean, this would be a really good one for the website.
Yes, sir.
Let's see.
Yep.
Get Sanjay. I got to get rid of that. Oh, there's a little piece of fat. Look at the pink right there. You guys can see a pinkish color, right? That pink right there.
Yes, we can. Yep.
Right next to the blue, which is the herniation. So let's get this picture. And Sanjay can put some arrows showing the pink.
Yes.
You can actually see kind of a pinkish reflection there. But that is the inflammation that we talk about so often. Let me get rid of this little doodad right there. I'm going to get some irrigation going. Sorry. Give me a second.
That'll work.
See if I can get a little better picture. A little piece of basically scar tissue. It's pretty stubborn. Anyway, you can see some of the inflammatory tissue right there. Let's go ahead and get that picture.
Copy that.
It's not as good as the one with the blue, but the blue is nice because it shows you where the tear is. So you know where the tear is, then you see how close the inflammatory tissue is to the tear. And that's your body trying to heal the tear. But it cannot heal the tear because you got all this disc material. And again, I discovered that 18 years ago, back in 2006. And we've published it, we've been trying to tell the rest of the world about it, but it's really hard to get information out in this day and age. Unfortunately, all the media outlets, they want money to get your message out. They don't care how socially beneficial your message is. They won't do it unless you're paying them. And we're not going to pay them because A, we don't have the money, but B, I feel they should be doing it for the benefit of mankind. So they all talk about how their social media is to help people and, make them better and things should be free. Well, then share this information for free. God damn it. Wipe it, please. I put it back in. It had the disc material in it. Make sure you get it.
Dr. Do we still want to show the how to cure the?
Yeah.
Yep. Perfect.
Yeah, we do.
Awesome.
We do want to show everybody what we're doing with the Deuk laser disc repair, how it cleans out the tear, and then right afterwards we'll take questions.
Copy that.
So type up your questions if you have them.
Disc injuries are a common cause of chronic back pain. The inflamed annular tear causes back pain. A 1/4-inch sized skin incision is made. A small tube is inserted with no damage to the bones or soft tissues. The laser removes the herniation and debrides the annular tear. The annular tear heals on its own after the procedure, which can take up to 12 months. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922.
All right, so you can see from the video then that the laser is used to find the tear with the scope and then clean the tear by getting rid of the herniation stuck within the tear. That's this stuff right here, as well as cleaning out the scar tissue and the calcium, bone spurs, osteophytes, anything that we see that's causing symptoms, we're going to clean it out. And that's what we're doing. The laser, for reference, which is the glass tip here, is 1 millimeter wide, 1 millimeter wide, 1 mm wide. So that gives you an idea of how big everything is. It's very small. There's some more herniation. And we're going to keep working on this herniation and annular tear with the laser while we take some questions, Henry.
Copy that. This question coming from Raj on YouTube,
Hello, Raj. Welcome to our live stream from Deuk Spine.
saying, "Hi, doctor. You're amazing. Is keyhole laser surgery good for ligament calcification, pinching cord, and T8 nerve root, and that level has instability? And when I breathe, the level moves without no fractures?"
Yeah, Raj. Very nice to hear from you, and thank you for your compliments. Would this surgery, is what I'm hearing you ask, would this surgery work for a thoracic problem? Now, you specifically said calcified ligament, and I don't know if you meant to say that, but it's interesting you would say that because calcified ligaments are very rare. And because they're rare, it that way, it makes me think either you don't have a calcified ligament, but somebody's trying to get you to do an invasive surgery, or you really do have a calcified ligament, but you just happen to be a red herring, we call it, somebody who has a problem that's very rare. So the best thing to do, Raj, if you want to know if this surgery will work for you in the thoracic spine, is to do our free MRI review. There's no charge. And I will look at your thoracic MRI. I will look at you. I will ask you questions that are important questions that I need answers to figure out what exactly is your symptom. And when I understand your symptom better, by the way, there's more inflammation right there. You guys see it? The red?
Yes, we do.
Perfect. So when I understand your symptoms, Raj, and I understand where they're coming from, then I can tell you if this surgery would work. But my suspicion, Raj, is that you have thoracic pain and that your pain is coming from your disc, not a ligament that's calcified. If that's the case, then this surgery would definitely work for you. On the other hand, if your symptoms are myelopathy, where you're having trouble with your balance, but you have zero pain, you just have weakness in your legs, balance difficulty, trouble controlling your bladder, peeing on yourself, incontinence, then, and it's coming from your spinal cord being pinched from the back, this surgery would not work for that. But like I said, that's a very rare situation. So it's hard for me to believe that you have that very rare situation. But it's not impossible. It's just improbable. All right, Henry, next question.
At this moment, no current questions, so we do have a comment coming from WD. It's not really a comment, but they just sent a heart emoji.
A what?
A heart emoji, just sending love.
Oh yeah, thank you so much. We appreciate it. So for those of you wondering what are we doing here, this patient comes to us from Ohio to Florida to have this surgery, laser surgery done. And his biggest problem was his right leg was killing him. It was hurting. We'd stand up and he'd get pain down his leg. He'd have to sit down. So he has what we call neurogenic claudication, which is leg pain, weakness, symptoms that get worse with standing. And so I looked at his MRI and did an MRI review, and I recognized that the problem he was having was a pinched nerve at L3-4 from this right here, what I'm working on right now. This is a herniated disc, and it's just one of many pieces. There's about 40 pieces of herniation. Right here at this disc, there's 40 pieces, and we have taken out maybe 15. The other problem he has is pain, but he's a tough guy, and nobody likes to complain about pain except for me. And so there's some more inflammation right there. So he really doesn't talk about his back pain much. He's found that by talking about back pain, doctors tend to ignore you. They just say we can't help you. So a lot of people go around, they're afraid to talk to their doctor about back pain because they think the doctor is going to see them as a drug seeker and not want to help them, right? So imagine you're walking around and you're trying to get help because your back is killing you, but you also have leg symptoms, and you go to every doctor and you mention, I got back pain, and right away they say, sorry, we can't help you. They close their door. Why would they close their door? Because right now there's an epidemic of patients with chronic pain that are addicted to drugs, and they go from doctor's office to doctor's office trying to get help. They're trying to get medicine. What they really want is they want to be cured, but the doctors cannot cure their pain. So instead, the doctors prescribe them opioids, narcotic painkillers, and those drugs, unfortunately, can kill you and make you addicted, and everybody's trying to stay away from them because doctors have basically are regarded as criminals if they give patients pain meds by our government, by the insurance companies. They don't want people to have access to pain control. So patients go around doctor to doctor trying to get help, trying to get relief of their pain, looking for answers, and the doctors don't have any answers. They just have shots or pills, and none of those are going to ever fix this problem, which is a disc pain. I showed you a video earlier where we showed you how the disc causes pain. It's simple. There's a tear in the back. I figured it out. There's a small tear in the back. It gets this blue stuff stuck in it, and then it just causes inflammation and pain. All you got to do is go in endoscopically with a laser like I am, clean it out, and the pain goes away. I've been doing this exact surgery for 18 years. We've published it. It's in PubMed. It's in the National Library of Medicine. We're recognized as the first people to ever do it. But I've tried sharing this knowledge with other doctors, other surgeons, and they don't do it. Why? We're almost done with the first disc, Dr. B. Why? Because the truth is, managing pain is big business. It makes a lot of money, not just for doctors, but hospitals, clinics, investors, implant companies like Boston Scientific. I'm not just picking on them, but I'm using them as an example. They manufacture devices, drugs, things that treat pain, okay? But none of those treatments work. They don't cure pain. They only help pain for a little while. And we have found the cure to pain, back pain and neck pain, and none of them want it because it's going to end their business. You understand? And these are billion-dollar companies, not billion, trillion-dollar companies, I should say. They make hundreds of billions of dollars a year selling, peddling their little devices and drugs and treatments that never really fix anybody. We found the cure at Deuk Spine for pretty much every cause of back pain, except for cancer, infections. We don't treat that. But 99% of back pain is caused by either the disc, the facet, the piriformis, the SI, and we have permanent fixes for all of them. But we have literally discovered the cure to back pain, and the companies and doctors and hospitals that profit off of your suffering are going to go out of business. You understand? I hate to use the example, but imagine if there were no sinners on earth, then Satan would not be a busy guy. Right? I don't know if there's a better example. Maybe there is. The point is, we're putting them out of business and they don't want it. And we're just one little company. We can only do a small volume right now. We need more patients. We need more money. We need more support to get more people this treatment. But we're doing everything we can. But someday you're going to see this treatment is what everybody in the world will get. This exact treatment. Because there is nothing better. I've done it all. I've done all the treatments. I've done all the spine treatments. I'm a spine surgeon, a neurosurgeon. There's nothing I can't or don't do or haven't done. Hold it. But the other treatments don't work well. Not compared to this. All right, any other questions, Hen?
Yes, we have a lot of questions. This next one coming from Mohammed on YouTube.
Hello, Mohammed. Welcome to our channel.
Asking, in my MRI, it came that L2-3 and L3-4 mild disc bulge and L4-5 and 5S1 broad base disc bulge, disc destination changes of L5 to S1. So is there any possibilities of getting ED in men with disc bulges?
I don't think so. I don't think you can get erectile dysfunction, if that's what you're asking. Erectile dysfunction.
Correct.
I don't ever see erectile dysfunction from disc bulges. Now, let's say your disc bulges hurt. You always have back pain. Well, then I couldn't get an erection if my back hurt all the time. I don't know anybody that could get an erection if their back hurt all the time, right? I'd be like, oh, my back's hurting me. Please get off. My point is, Muhammad, that when you're in pain, it's easy to understand why you can't get aroused. Now, I'm not saying to you that the disc bulges are structurally causing like pinched nerves that give you erectile dysfunction. They don't. I don't believe that's the case. However, it could be that either your pain itself or a treatment you're taking for the pain, I don't know what you're taking, but there are drugs you can take for pain that would definitely affect your ability to get an erection. Right, Dr. B? Yeah, so there are drugs that you can take for back pain that would affect your ability to get an erection, okay? So that could be the reason, but I don't think the disc bulges are themselves causing your or whoever's erectile dysfunction.
Alrighty. With these next two questions come from Marcus on YouTube.
30 seconds on this disc, and then we're moving on to the next one. Yes, Marcus.
First question they asked. Oh, no, it's a follow-up question. They asked, do symptoms like pain or numbness in the butt and or leg ever come from S2, S3, or lower foramens?
Oh. You guys see that herniation that just popped out from under the ligament right there? The thing is huge.
Yes, we do.
All right, so do herniated, what was the question? Do herniated discs ever cause S2, S3 symptoms?
Do symptoms like pain or numbness in the butt and or leg ever come from S2, S3, or lower foramens?
No, they don't come from lower because there are no discs lower. S2, S3 doesn't have a disc. It's just a solid bone, so it cannot cause pain, any symptoms. Yeah, good question.
Next question asking from Raj, once more on YouTube, asking, hi doctor, thickening of the facet and ligamentum flavum on the next side is seen at T8, T9 segment, some narrowing of the left neuroexit foramina, compression of the exiting left.
Is this Raj again?
Yeah, this is Raj again.
Yeah, Raj, your report is meaningless to me. I don't trust the other radiologist's read. I would need to see it myself, just so you know. So I'm not going to comment on someone else's read of your MRI, Raj. You need to have me look at your MRI if you want my opinion. Good surgeons do not make opinions based on someone else's interpretation of diagnostic imaging. Good surgeons never do that. Good surgeons look at the MRI themselves, and they make up their own opinion. And the reason for that is radiologists miss 95% of the important things on an MRI. 95% on average. So if the radiologists miss 95%, that means their reports miss 95%. If their reports miss 95% of the important things on an MRI, how could you possibly get a diagnosis? You can't. So I don't rely on a radiologist's interpretation of your MRI. I rely on my interpretation of your MRI, okay? So don't bother reading your report or typing your report on this chat because it's not going to help. I don't trust it. I don't believe it. I have to see it with my own eyes. All right, almost done. So I was about to finish, and then I encountered all this extra herniations that was hiding underneath the posterior longitudinal ligament, right out the foramen. Here's some of it. I think this disc is the worst one, right? Is 4-5 the worst one or 3-4? Huh? Yeah, but here's the thing. With an MRI, if you got it done a month ago or so, then now you're here. You could have made it worse at one of the other levels. So remember, MRI is a snapshot, a picture of just a moment in time. Hold on. 4-5? Yeah, it's the one we're at right now, right? Yeah. So that's why I'm seeing so much herniation. Now, one of the other things I want to mention to everybody is when we go in and clean up these disc herniations, we cannot get 100% of the herniation. It's impossible. We can't even get 99, not even 90. The best surgeons can only get maybe 60, 70% of the herniation. There's always going to be something left. As a matter of fact, the MRI is never going to look normal again. So don't expect you have surgery and the MRI is normal. It's going to be normal once you have an injury to your spine. Okay? Never. Now, you can have structural goals with an MRI and surgery, structural goals, or you can have physiological goals. The difference is, just so you understand, a structural goal would be something like fusion, right? You do a fusion, you want to see the bones are fused together. So the surgeon is looking for the bones melding together in the patient after surgery. That's a fusion. Oh, that's... All right, Henry, I'll take some more questions while I'm working on this piece of herniation right here. See if I can grab that.
Alrighty. This next question coming from Jeff on YouTube. Asking, I have major disc degeneration, L5 to S1, chronic lower lumbar pain. I'm getting nerve ablation, but if that doesn't work, can you help? The disc is basically gone.
Yes.
A convex right curvature of the lower lumbar spine is noted.
Yes.
There is multi-level degenerative disc disease with disc height and yeah.
All right, listen. I'm going to tell you this again. You saw the video. I encourage you to watch it again. The video is very clear about the causes of back pain. Facet pain, which accounts for a good portion of people with back pain, accounts for 10% of chronic back pain. So facet pain is treated with rhizotomy. Now, the RFA procedure you're talking about is a type of rhizotomy, but it's called a rhizotomy even though the procedure actually doesn't do a rhizotomy. Okay? It's weird. Medicine is weird, right? And a rhizotomy means you're cutting a nerve. You're cutting a nerve, and the nerve you're trying to cut as a doctor is a sensory nerve. You want to cut the nerve that goes to the facet joint that carries all the pain up to the brain. You want to cut that nerve. It's called a rhizotomy. But the problem is the RFA rhizotomy doesn't do it. They say it's a rhizotomy, but it's not actually a rhizotomy. It's an attempted rhizotomy. Okay? And so RFA, it turns out, doesn't work. And if it does work, it certainly doesn't last. So yes, we can definitely help you because your pain is probably coming from your discs, not your facets. And if it is your facets, we do the Deuk plasma rhizotomy, which is a true rhizotomy. On the other hand, if it's not your facets, we do the Deuk laser disc repair. But you need a diagnosis, my friend, and that we do for free over the internet with Zoom. And I recommend you take advantage of our free diagnosis. All right, I think I'm done here. I don't see any more herniation that I can get. Let me just get this last bit right here. Just going to clean the last bit of this tear. We've gotten quite a bit of herniation out of here. I think I probably got hopefully 60-70% of it. Remember, I will never get 100. Nobody can get 100. All right, you have other questions?
Yes, this next question coming from Sarp on YouTube.
Hello, Sarp.
asking, "Hi, sir. I
there.
am a neurosurgeon in Turkey. Here, so much stabilization made for lumbar central canal stenosis and foraminal stenosis, almost for all patients, and that includes vasectomy. We see all roots. What's your thought for this unnecessary fusion? We
Yeah.
clean everything, but on the other hand, we destroy stabilization of the spine, I think."
I agree with you, Dr. Sarp. You are correct, 100%. Too much fusion, too much destruction of the spine to do the fusion, too much, we call it iatrogenic instability, where the surgeon creates the instability with their surgery. You're right, and I'm advocating for people to understand the truth about invasive spine surgery, whether it's microdiscectomy, laminectomy, artificial discs, spinal cord stimulator. All of this is unnecessary treatment now. We have very specific treatments for very specific targets that are very minimally invasive. They don't involve any implants, no biologics, no stimulators, no screws, no cages, no rods, nothing. Just natural repair of the disc like you're watching now, or denervation of the facet joint or other type of painful joint. But these treatments are only available at Deuk Spine. And that's good and bad. It's good because of quality control. It's bad because of accessibility. We want our services to be more accessible. But these are cheap services. They don't cost a lot to provide, but they take a lot of money to buy everything to be able to provide these services. So millions and millions of dollars. There's a huge upfront cost to performing these types of surgery, but we don't have screws and rods going in that cost more money. You know, screws and rods in America can cost $1,000 a screw, $500 a rod, and the cages are $3,000 to $5,000. Depends on the kind of cage and who makes it and how many you use. But those are good pricing, by the way. There's original price, list price is even more. So unfortunately, there's a lot of unnecessary spine surgery implants being put in because it's making lots of money for the surgeon and for the hospital and for the company that makes those implants that's promoting it. Okay? So I agree with you. It's a problem that needs to be addressed. And as a matter of fact, we're producing a movie. I'm producing a movie that's coming out in January that's called Spine Scam, and it's going to expose the entire industry. I've already paid for the movie. He's moving a little bit, and it's coming out though. It's coming out very soon. So you'll be able to see, it's more of a docudrama, but you'll be able to see a little bit of insight, and the public is going to see it too. They're going to see what's happening. And that's what the only way to bring around change is through public. The public has to know the truth. All right, we're done here. We have one more disc to go. Hopefully it will not be as long as this one. This one took us a long time. Scope off. And the reason this one took a long time, it was I think the larger herniation. But it was also, the herniation was in about 30 or 40 pieces, probably around 35 pieces of herniation. Oh, damn it. Come on in here, Jordan. Why is that so dilute? Is there a reason?
No, I mean,
Is it normal?
no, it's once you see a piano and then four of the normal. I mean, we can do less. So we can do more.
But why more volume? Why? Patel likes more volume?
Yeah,
Why
I
are
would
you?
do it like that, yeah. But they're actually used a different.
All right, we're going to move on to the next disc, which will be number 3-4. Again, right approach, guide wire.
We have a question.
Yeah, let's go on with more questions. Shot.
This question coming from Steven on YouTube.
Let's do this question, and then we're going to show you what we were talking about facet joints being the second most common cause of chronic back pain. And we're going to show you how facet joints cause back pain next, after this question. Shot?
Steven on YouTube asked, need a patient for the
John?
movie? I'll do it for free.
Steven, you're awesome. Thank you so much. The movie's already been shot in San Diego. I have a director who's an independent, indie film independent director and producer. And I'm the executive producer, the guy who pays. But I also wrote most of the script. I mean, the basic script. I didn't write the mushy scenes, you know. We had to have some mushy scenes with some pretty men and pretty women to keep some of the younger generation interested, but I didn't write those scenes, okay? So don't hold up. But a lot of the scenes I thought of, hold on, because they came from real life. They came from real life experiences that I know, Shot, are happening around the country and around the world, where basically surgeons are being bribed to put in expensive implants in patients' spines unnecessarily. And some of the surgeons are so corrupt, they just care about the money and nothing else. And a lot of the younger surgeons don't realize what's happening, but they're learning and finding out. So it's a good docudrama, and I appreciate the offer you've given us to be a patient in there, but it's already been shot. We're just going through editing. And after editing, we're going to see if Netflix wants to buy it or Disney. You know, we'll try to find a big streamer who will take it. And if they don't want it, then it'll be on our Deuk Spine website. So we'll see. Apparently there's a lot of interest, but I don't know. You never know, right? It ain't over till the fat lady sings. That's the saying we used to say. Okay, let's show our audience. I need that. Let's show our audience the facet joint. Why does it cause so much pain? Again, you can see the inflammatory tissue right there. It's red. All right, welcome back. So you can see from the video we just played that the facet joint causes pain after it's been injured. And sometimes it'll take years and years for the facet joint to become painful. It doesn't happen overnight. You may have pain immediately upon trauma, the trauma to the joint, but generally speaking, the chronic debilitating joint pain, the arthritis pain of the joint, doesn't come for several years, okay? I just told my anesthesiologist I think we have about 10 minutes, but this disc is an interesting disc. It's just like the last one. Look at these pieces here. They don't want to come out. And they're not coming out because they're scarred. They're really scarred down. And the laser is the only way to release that scar tissue. You can't really do it any other way. But I have to release as much of the scar tissue to get the herniations out as I can, and then I got to go in and just grab them and try to pull them out this way, okay? But I personally don't like these kind of herniations. You may wonder why. Because they just take a lot of work And I am not the most patient person, but the thing is, I'm not a patient person, but I am a patient person. In other words, I will stay until the end, until everything that's done can be done. But I won't enjoy staying until the end because I like to get things done quick. You know? It's kind of like if you're playing a video game, you get to the end of the level and you're facing the level boss, but you've already beat the level boss and you know how to beat the level boss. It's just going to take 15 minutes to beat the level boss. And you're like, I already know how to beat you. Get out of my way, but they won't move. They just stay there, and you have to beat them. All right, so there's a game I play that's just like this. It's, anybody ever hear of the game called Half-Life?
Of course, yeah. It's a great game.
So it's one of the Half-Life games, and there's this giant creature that shoots these little flying droids around. These little creatures that shoot very powerful white. And to beat him, you have to do certain things, okay? But it's a pain in the butt. I know how to do it. But honestly, I'm stuck at that level right now because I don't want to spend 20 minutes beating him again. I just haven't even picked the game up. That and the fact that I've been working on the website and working on a bunch of other projects like the movie and other things. The point I'm trying to make is, if you ask me why I don't like these particular disc herniations, it's because they're so shattered and so scarred that they really do take a lot of extra time. But I already know how to beat it. I just don't like spending the time beating it. That said, for each patient, I will spend my time beating it. If that makes any sense. I'm not going to lie to you and tell you I enjoy it, but I am going to tell you the truth. Truth is, I'll stick it out to the end, but I don't like it. I like how patients feel afterwards, and that's why I do it. When the patient comes in and says, my pain is gone, thank you so much, and you've seen those testimonials, we have hundreds of them. When you see that patient the next day and they're happy and they're feeling good, that's why I do what I do. Otherwise, I just stay home. Any other questions?
No current questions. So in the meantime, we've shown what causes facet pain. Why don't we
Let's show
show how to cure facet pain?
Henry, that's a really good idea. Let's
Awesome.
do it.
Copy that.
Facet joint injury is a common cause of chronic back pain. The inflamed facet tear generates pain signals. The best treatment for facet joint pain is the Deuk plasma rhizotomy. Inflamed facet joint pain nerves are destroyed. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922.
All right, welcome back. You can see that facet joint pain can be cured if you do a rhizotomy. Rhizotomy is basically cutting and destroying those pain nerves that transmit the signal from the facet joint up to the brain. And I figured out the way to do that permanently, the only way to do it. And actually, there is another way, but it's fusion and putting screws and rods. So the Deuk plasma rhizotomy is the alternative to fusion. It's much safer, faster, recovery, better for the patient, better for everybody. Fusion is very expensive. And I used to do fusions for facet pain all the time because I didn't know how to do the Deuk plasma rhizotomy. But once I learned the Deuk plasma rhizotomy or developed it, I realized we don't have to do fusions anymore for facet pain. And by the way, we would always try the RFA first, you know, and I'm talking about patients who had the RFA and they got better, but then the pain came back. So we knew they had facet pain, but it keeps coming back. So I used to fuse those patients. I would tell them, look, your facet pain is going to keep coming back unless we take your facet joints out. And the way to do that is, it's called an osteotomy. You go in and drill them off, cut them off. If you watch my YouTube channel, you can see a lot of those types of surgery. They're called T-lift, T-L-I-F. And I don't do the T-lift to remove the facets. I do it to do a fusion, but in that procedure, we cut the facet joint out. You can see that happen in that surgery. So if you want to watch facet joints get cut out and fused to treat facet pain, you just go to our YouTube channel and look at T-lift surgeries. Henry, you can probably put a link here in the comments so people can do that.
Copy that.
But that's the old way of doing it. The Deuk plasma rhizotomy is much better. Much, much better. So you don't need to do fusion anymore. Any questions?
At this moment, no current questions.
All right, you guys are boring. Just about done. I'm here looking lateral at the lateral part of the herniation. I'll give you an update on my garden. Why not, since there's no questions. Just bought a bunch of gingers for my garden. I don't just grow orchids. I also grow ginger. Anybody else garden here besides me? No? I don't blame you guys for being boring, but I'm not judging you guys for being boring or anything, but you know, I don't blame anybody honestly for not gardening. I didn't garden for the last 40 years. It was only this year that I got bitten by the garden bug. Before that, I was growing coral. Yes. We're done. Just in 2 minutes. If you can manage it for 2 minutes, we're good. So I bought these gingers. They're called torch ginger. If you've never seen a torch ginger, I saw them overseas. They're from Hawaii, and they are so beautiful. I'm trying to get it in my nursery, but the lady can never get them. She keeps telling me she's going to get them, then she never does. So I went online and I found some, and I just planted them. Anyway, if you get a chance, check out torch ginger. They need tropical climate to grow, but they're really cool. Really, really cool. All right, 30 seconds, we're done. Any other questions? Type them up. I can come and answer them. 10. 5. Oh, just when I thought I was done, it got me again. There's a piece right here I want to work on for a minute. Give me another minute. You can see the epidural fat, epidural veins, epidural piece of herniation. Really bothering me. All right. Just about done. Any questions, Henry?
At this moment, no current questions.
All right, well, we will be back. Today is what, Thursday?
Thursday, correct.
We're going to be back Tuesday with more surgery. We do have some unique surgeries coming up. We have a surgery you'll never see in your lifetime besides when I do it here. And when is that one? September 12th. It's a Thursday. It is what's called an occipital cervical fusion, OCF. And these are surgeries done for really two reasons. One, somebody gets into a motor vehicle accident and their skull comes off their spine, or they get the, what is that thing, the Y-strap, right, Henry?
Yes, the Y-strap.
chiropractor
Yeah.
Pulls their skull off their spine.
Yeah.
Or they have rheumatoid arthritis and they develop what's called basilar invagination, which is what this patient has. And we're going to do an occipital cervical fusion, putting a metal plate on her skull and fusing it to her cervical spine through the back. She is not a laser surgery candidate. And that's the only surgery we can do. All right, we're done. If you have any questions, feel free to ask me. I don't see any more herniation. Scope off. Type up your question. Henry, any questions?
We just have one question coming from Essential Advantages on YouTube,
Welcome back, Essential Advantages.
asking, what if I don't have much pain but mostly limited range of motion in the neck?
Great question. If your range of motion is limited because when you turn your head side to side, that's probably facet joint pain if it's causing pain when you turn your head. If you have no pain at all, but you turn your head and it's just stiff and you cannot turn, but there's no discomfort at all, then you may have ankylosing spondylitis where your spine is fusing itself. Again, I'm guessing, but I would need to get x-rays, CAT scan, MRI to see, and do a physical exam. All right, let's show the audience. Folks, take a look. Those two discs were fixed with an incision that's 7 millimeters. Okay, tiny, tiny incision. Have a wonderful rest of your day, and we appreciate you joining us. We lost maybe 2 cc's of blood. We fixed 2 discs. He's going to be very happy. All right, thanks for joining us.